Antibiotics are under threat like never before. We're in danger worldwide of losing the effectiveness of what have been some of the most effective, if you want, wonder drugs of the last 3/4 of a century. These drugs, since the 1940s, have been the enablers of modern medicine, quite apart from curing people that would otherwise have died of conditions like meningitis. The presence of antibiotics has allowed surgeons to do more complicated surgery, allowed implants of knees and joints, and have allowed cancer services to develop dramatically. If we're to lose the antibiotic effectiveness, a lot of these modern medicine developments will go into reverse and some may stop. Efforts to preserve the effectiveness of antibiotics, especially when there are less and less new drugs becoming available, rely to a large extent on the stewardship of the remaining drugs that we possess. Now, stewardship is the concept of looking after the drugs and optimizing their use in a way which will minimize the development of further resistance. Now, to do optimal treatment of a patient, one ideally needs to achieve 4 or 5 things. One needs to have some understanding of what you think the infection you're treating is, which allows you to choose the right drug for that condition. The right drug then needs to be given at the right dose. There are different doses required for different infections. The drug then must be given by the right route, because some drugs are absorbed orally, other ones need to be given intravenously, and so therefore one must deliver it by the correct method. And finally, once you've elected to treat a patient, you should be using the right drug at the right dose by the right route for the correct duration of time. So the correct duration is the 4th component of the strategy to make sure that you're optimizing your treatment. Finally, you need to put the drug in the right patient, just to make sure that you haven't actually given it to somebody that you didn't intend to. So that well understood mantra of how to treat correctly has been expanded largely into the concept of antimicrobial stewardship. So fundamentally, this is everybody's responsibility. It's the responsibility of the healthcare professionals who are prescribing the drugs to understand the optimal methods of choosing drugs, doses, durations, and routes. It's also, to a certain extent, the patient's responsibility to understand there are less and less of these drugs available. The ones that remain are becoming progressively more valuable for the sickest people, and we mustn't waste drugs which would be needed when somebody is extremely unwell. Finally, all of these strategies will work if everybody internationally does the same things. Bugs don't recognize borders, and so the best possible practice in one country can be injured by lesser practices elsewhere. And one has to remember as well that a lot of antibiotic consumption is not in human beings at all, but is in farm animals and in agriculture and veterinary medicine. All of these things must work together for us to achieve our aims.